My name is Jessica Martin, and I'm going to be doing a complete abdominal assessment today. First, what you want to do is inspection, and then auscultation, and then you have percussion, and then palpation. So first, let's get set up. We're first going to be doing inspection. So I'm going to be inspecting the abdomen with my patient. I'm going to look at the umbilicus. I'm going to assess the skin for condition and color. I'm going to assess for temperature. I'm going to inspect the size and the shape and symmetry, make sure each side is even. I'm going to look at the color, make sure it's not blue or jaundice. I'm going to make sure it's a even color throughout. I'm going to notice any lesions, any surface movements, and I'm going to note any visible veins on the abdomen. I'm going to assess for distension and evaluate for ascites. I'm also going to be inspecting the urine, make sure it's clear and light yellow, make sure there's no vomiting, and stool is going to be soft and light brown. After inspection, I'm going to auscultate. So I'm going to use my stethoscope, and I'm going to be auscultating all 4 quadrants. Now I'm going to start in the patient's right lower quadrant and then go to the right upper quadrant, and then to the left upper quadrant, and then the left lower quadrant. Now bowel sounds should be high-pitched. Gurgles that last from 1 to several seconds, and I'm going to listen for up to 5 minutes. I'm also going to be listening for vascular sounds, and that's going to be with the bell of the stethoscope. I'm going to be listening for bruits, venous hums, and friction rubs. So when I listen over, I'm going to first listen over the aorta, which is going to be in the epigastric region. And I'm going to listen for bruits. And I'm going to listen in the patient's right renal artery, the right iliac artery, the left renal artery, and the left iliac artery for bruits. And then I'm going to listen over the right femoral artery for bruits, and then listen to the left femoral arteries also for bruits. Now venous hums, those are going to be near the liver, which is going to be on the right, and over the umbilicus. So I'm going to listen for bruits over the liver and kind of in that region over the umbilicus. And then lastly, I'm going to auscultate over the liver. Also, I'm going to auscultate over the liver on the right for friction rubs, and then auscultate on the left over the spleen for friction rubs also. So I'm done with auscultation, and then my next thing I'm going to be percussing. So I'm going to percuss in all 4 quadrants. You take your hand, so I'll do the right upper quadrant, right lower quadrant, and then left upper quadrant, and left lower quadrant. I'm going to ask the patient if there is abdominal pain. If there is pain, I'm going to percuss the area last. I should hear dullness over the liver in the right upper quadrant and over most of the abdomen. And tympanic sound should be heard, dullness is over the right upper quadrant liver, and then tympanic sounds should be heard over most of the abdomen, and this indicates presence of gas. And then the next one, I'm going to assess tenderness of the kidneys. So by doing that, I'm going to have the patient sit up. I'm going to place the palm of my non-dominant hand over the costovertebral angle, where the rib cage meets the spine, and I'm going to hit that hand with the fist of the dominant hand, and then I'm going to repeat that on the other side, and no pain should be felt over the kidneys. And then the liver span test, which is figuring out the size of the liver. I'm going to start at the right midclavicular line at the third intercostal space, and I'm going to start percussing, just percuss down until the resonance changes to dull. And then when I get to the fifth and sixth, that's when the dullness should be heard, because that's where the liver will be. And then right when the dullness begins, I'm going to take my pen and mark it, and then I'm going to have that marked, and then I'm going to go below and start percussing still at the midclavicular line at the umbilicus, and percuss upward until tympani turns to dullness. And then mark that area with a pen, and then I'm going to measure, get my tape measure, and I'm going to measure the distance, which should be between 6 and 12 centimeters. Now, to figure out the spleen size, I'm going to percuss from left midclavicular line at the costal margin. Left midclavicular line at the costal margin to the mid-axillary line. So basically, I'm just going to percuss over the spleen area to see if tympani is heard. Splenomegaly is unlikely if tympani is heard. And then I'm going to assess the bladder. I'm going to start at the symphysis pubis and percuss upward toward the umbilicus, noting any dullness. To assess for ascites, you're going to also be percussing. You're going to percuss dullness in the umbilicus area when the patient is supine, so they're laying down. Then have the patient lie. They're going to lie on the right side, and then I'm going to percuss again to assess for dullness. And then last is going to be palpation. First you do light palpation, and then deep palpation. So the light palpation, same thing, going to be in all four quadrants. I'm going to press down about 1 to 2 centimeters in a rotating motion, and I'm going to observe the patient and make sure there's no grimacing, guarding, and no tenderness should be noted. So then next you do the deep palpation, which is to assess the organs, masses, and tenderness. I'm going to use the tips of my fingers, and I'm going to press a little bit deeper this time, about 4 to 6 centimeters in all four quadrants. It might be a little bit uncomfortable, but tenderness should not be there. And then I'm going to palpate the liver. So I'm going to place my right hand at the midclavicular line under the patient's costal margin. And I'm going to place my left hand on patient's back. So I'm going to have him sit up, and on the back it's going to be at the 11th and 12th ribs. And then I'm going to press upward to elevate the liver toward the abdominal wall with my left hand. And then I have the patient take a deep breath. And then I'm going to have the patient press my right hand deeply in during the inspiration when they're breathing in. I shouldn't really be able to palpate the liver. And then to palpate the spleen, I'm going to stand on the patient's right side. I'm going to place my left hand under the costovertebral angle, and I'm going to pull upward. Oh, wait. Yeah. I'm going to pull upward to move the spleen anteriorly, and then I'm going to place my right hand under the left costal margin. Have the patient take a deep breath during exhalation, and I'm going to press inward along the left costal margin and try to palpate the spleen. Now the spleen also should not be palpable. And next I'm going to palpate the kidneys. I'm going to assess the left kidney. I'm going to also be on the patient's right side. I'm going to place my left hand in the costovertebral angle and place other hand at the left anterior costal margin. I'm going to have the patient take a deep breath and then press my hands together to capture the kidney. When the patient exhales, I'm going to tilt or lift my left hand and palpate the kidney with my right hand. And then I'm going to do the same thing on the opposite side to palpate the right kidney. Again, you shouldn't really be able to palpate the kidneys. And then we're going to palpate the abdominal aorta. So I'm going to place my fingers in the epigastric region. And then I'm going to palpate for aortic pulsations on either side of the aorta. Pulsations are normal, and it should be about 2 centimeters. And then lastly, I'm going to palpate the bladder. I'm going to use deep palpation in the hypogastric area. An empty bladder should be done, and it's neither tender nor palpable. And then the last thing we need to do is elicit the abdominal reflex, which we're going to be doing that by stroking the abdomen lightly with a tongue blade. I'm going to use my pen. The abdomen is stroked in all 4 quadrants toward the umbilicus. The umbilicus should move toward the stimulus, and that'll be normal. And that completes the abdominal assessment.